Hello, I'm Jonna Mazet, and I'm the Vice Provost of Grand Challenges here at UC Davis. And I'm just thrilled to tell you all about what we're working on and how we're using a wellness lens to really look at, address, and try to tackle the planet's most wicked problems. So our vision here at UC Davis is to harness the power of our whole campus community to really work on these challenging problems of society, the planet, and our individual wellness. We want to really use that power, the thousands of people here. Do you know that we have 7,500 researchers working across disciplines on this campus? So we have this huge capacity for innovation. And what's also really special about UC Davis is that we have this culture of collaboration where we all want to work together and we want to work for the greater good. And so I'm thrilled to be able to tell you that we're now embarking on a new initiative to pull people together to more holistically look at these really challenging and complex issues that the world is facing so that we can go beyond our own science individually in the labs like I used to do and actually come together and think about things with a different sort of perspective. Think about using our scientific disciplines, our humanistic disciplines, and all of them come together to think about how people make choices about their own health and wellness, about their community's health and wellness, and about the world and the planet's health and wellness. And so I'm just thrilled to be part of this great event and what UC Davis is doing in wellness education. We really feel like we have the capacity to just go over the edge of where we've been nibbling around the edges of these problems and really bring to you and to the world a new kind of partnership where we address these problems together in a more holistic fashion that will allow us to solve them instead of just keeping doing what we've done in universities for centuries, working in our ivory tower and hope somebody uses that information to do something good. What's also really special about how we're doing that here at UC Davis is that we are using social and environmental justice and thinking about inequities and people's access to all of the benefits that they should be getting from programs around the world that are addressing the greater good, but how many populations do not have access to those things. And then how environmental justice is really at the core of many of our most challenging problems. So by thinking about individual, societal, and planetary wellness, we think that we have a chance to go even farther than the world has been able to go so far with some of these horrible, wicked problems that we're facing. I'm going to talk to you a little bit about One Health because that's my background. I come from a background of looking at complex kind of global health problems and trying to address them in a more holistic way. So I guess that's part of why I'm here talking to you today is because I was selected for this position to take the campus's activities and strengths to the next level using what I think of as a One Health approach. And that is a collaborative, multi-sectoral, and transdisciplinary approach where we work together locally, regionally, and nationally, but we bring together all of the stakeholders and experts to really listen thoroughly to each other, understand each other, and look at that intersection among the health of the environment, plants, animals, and people to try to come up with solutions that will serve us all. So I've just listed a few of the problems that we address with the One Health approach, and you're going to see that many of those are similar to what we've chosen as a campus community as the wicked problems that we want to address first. I'm going to talk to you a little bit about zoonotic disease emergence. Probably most of you know what I mean by that, but it's the transmission of pathogens between different animal species, and that's where most of our emerging health threats come from these days. We unfortunately are using the planet in different ways than we evolved to use it. So we're traveling around everywhere and we're going into pristine forests and we are looking for things like what you need to make your cell phone lighter and thinner and more useful and faster. When we do that, we go into caves and things that are really remote that we haven't been in before, and we bring workers, and the workers, of course, we bring food animals with us, and they mix with the animals in those pristine forests. And what can happen? Well, they can bring pathogens that humans have not really seen before evolutionarily into other population areas locally, but then also into urban centers, and that can be really dangerous. Then we have what we call a spillover event that leads to an epidemic that could lead to a pandemic. So we want to really start thinking about that differently, and that means thinking about what we really need for our cell phones. Is it thin enough, light enough, fast enough? Do we really need the next best thing? Or do we want to weigh that with the risks of, taking something else from the planet or going into other pristine areas? So there's a big part of this that is really thinking about our wellness more comprehensively than I feel well when my phone works, right? Because I can get through my day. But in the big picture, am I doing the right thing by making that consumer demand? So all of these things are really connected. And I show you some of the drivers for what we want and need that are pushing these problems to being more and more critical. So how we use land, I just gave you that example with the caves, but also connected to that is climate change and what that's doing for our health and what that's doing for driving emerging infectious disease risk. And I hope to sort of show you that all of this is connected, and it's connected because of our culture, our demands, our policy, our economic desires, and our personal behavior. So that's how we're going to spend a little bit of this time this morning, is talking about that, using that sort of approach, and then the lens of wellness, as I mentioned, as well as social and environmental justice to address the world's big challenges. For us on the campus, that means we're taking these big problems and we're making them the top priority, because UC Davis wants to address the wellness here at home and the wellness around the world. And so we have established this program with our grassroots, our campus community, saying this is what we're good at and this is what we want to do. We want to do it better. And we have our top leadership, Chancellor May, Provost Krogan, saying, yes, this is what UC Davis is all about. We are going boldly into the future, and we want to help the planet be successful and, frankly, the human species to survive and flourish. So we're using those lenses and those approaches to really facilitate collaboration in a new way and enhance our opportunities for discovery and advancement. We are bringing in those folks that haven't always been involved with some of the crises that tend to lend themselves to sort of STEM or science, technology, engineering, and mathematics disciplines. We need the social scientists, we need the communicators, we need the people who understand how decision making is happening. And that includes people who educate children, people who know how the brain works and when the brain's pathways for how we make decisions change over time in our upbringing. And so we're so lucky that at UC Davis we have all of those disciplines in one place, so we can really think about things in a wellness lens, where at some places we're not able to do that because we only have one or two of the disciplines, but because we're such a vast and deep campus, we have that ability. So when we decided to embark on this new voyage, we really wanted to think about the issues that our campus community would recognize as wicked problems, and where we had strengths here in the expertise that could help to actually make those wicked problem solutions become more real and then realize their implementation so that we can actually have societal benefits. And of course, we wanted our whole campus community to be able to have a role in that. And so that means the challenges that we picked are really, really big. The first one I'm going to talk to you about is emerging health threats. I already gave you a little hint that I was going to do that. And again, it's probably a little bit my comfort zone because that's the background that I come from. But I wanted you to know that the 4 grand challenges that we chose to embark on first are emerging health threats, climate solutions, the sustainable food systems, and then reimagining the land-grant university. And I'm going to talk you through all of those just briefly now. From emerging health threats, it's not just those new diseases that are coming our way. I know we're all thinking still about COVID and what that's meant for us for the last few years. And I know right now, today, you're experiencing your friends, neighbors, family members all getting COVID again. And I'm sorry for that. I hope the outcomes of the current sort of new uptick are not significant. I hope that they are being mitigated and so that people are not getting as sick as they ever did before. But I think this little uptick tells us that we need to think differently. We can't just keep hoping that what we did in the past for influenza and other diseases is going to work for every new disease that comes. And luckily, Davis is an expert on those new, novel kinds of pathogen threats. You know what else we're great at, and I'm not trying to do a sales pitch, but I'm just so proud of our campus community, is we have some of the finest neuroscientists and people thinking about mental health and wellness anywhere on the planet collected here at UC Davis. So if we can merge those communities where we're not only thinking about what's coming next, the tsunami of the next scary thing, but how we actually right now get in front of it, how we think about how to message around these things, how we help communities be empowered to act and to make good decisions. And that's why we really need to blend the neuroscience community with all of the health threat community that's out there. And I do want you to know that we are vulnerable. And this, unfortunately, this terrible COVID pandemic was not a one-off. We have been having more and more epidemics of regional or larger scale. Just in the last few years, we've gone from recognizing 3 new viral diseases in people each year to on the order of 5, and maybe more now because there'll be more work on it and more discovery. Yet, before the pandemic, your colleagues here at Davis, but also around the world, there were just a sort of small portion of the scientific community working on what we call Disease X. Now that we have awareness because of, sadly, all the suffering and all of the diseases that are coming now because people had COVID and had this severe viral assault on their systems. So now we're going to see, sadly, more stroke. We're going to see more heart disease. We're going to see more dementia-type diseases because people got so sick that the recovery from that is protracted. So we're now thinking not only about the disease that attacks us, but the sequelae that we need to be ready for. So it's decision-making, it's the disease itself, and it's everything that comes after, including mental health and wellness, which is so crucial. And we're seeing with our school-age children that missed out on some of their education and socialization, as well as elderly folks who might not have developed some of the problems that they're developing now because they were exposed and infected with COVID. Now, we can't eliminate every spillover event or disease outbreak, but we can get ready for them, and we also have the expertise here to actually identify those threats and stop them spreading at their source. So I'm going to tell you a little bit about my own personal experience here working at UC Davis with a vast number of people, expertise across disciplines, and our global networks all over the world. What we were able to do in just over a decade is take the world from recognizing there are about 260 of those viruses known to go between people and animals and had been documented, to recognizing that there are 500,000, 500,000 that are out there still to be discovered. And what we need to do to safely discover them without people having any accidents or getting sick, and prepare so that we can reduce our risk and be ready if and when there is another spillover event. And so we took on a big comprehensive look with funding from USAID, sort of in 30 countries. We really started in 40 countries, but substantively in 30 countries. We looked in those caves and the wildlife in and around those caves where we're working on cell phone extraction materials. And we documented what things there were available to spill over into those food animals or spill over into people directly or remix in the food animals and other wildlife to cause and create something that's more dangerous. So we have those experts here, and now we're connecting them with the other disciplines, like the people working in the communities, to say, how do you want to protect yourselves? Instead of always being so top-down, where it has to be a law that tells you you can and can't do this. I think the world is moving beyond that, and we want to work together, and we're trying to foster that kind of application of problem solving here at UC Davis. So we want to reduce the risk, right? We want to reduce the risk and improve control so that we're not just working on controlling diseases after that genie is already out of the bottle, but we are ready and we can stop them almost at their sources so they don't become large-scale epidemics and pandemics. We work all over the world in some not so sexy places to find those viruses and start to identify human behaviors and national policies that are really enabling the spillovers or encouraging them even. And that's allowed us to start to understand how people are sharing viruses and under what circumstances. What kind of industries are we promoting that are increasing our risk? What are alternative livelihoods for those people that are in those industries so they can be safer and their communities and the world can be safer? So we're looking at it from all sides of those coins, just as an example. And that means we have wildlife experts, ecologists, veterinarians, epidemiologists working on the early recognition, but we also have clinicians, people working in clinics all over the world, doing that syndromic surveillance to try and identify those same viruses that we're seeing in wildlife and get a high-risk, prioritized, ranked list of what we should be preparing for so that we're not caught totally unawares like we were the last time. And some of that helps us to do things like, if we know what hosts in the animals carry these diseases, we can start to understand where the risks are. And they are often much broader than just where the last epidemic happened, so that we can prepare more broadly and help, again, communities reduce their risk. Just as an example, this is some of our work in Vietnam, where we were able to document that out in the wild, where people are sort of trapping rodents to reduce the pest problem in their farms, but also to capture them, bring them into captivity, breed them, even sell them into the market place, and these are often markets that are mixed with other wildlife. We can track that when the rodents are out in the wild, about 20% of them in the areas where we were looking were infected with coronaviruses. Many of those unknown risk coronaviruses that we don't know yet if they can infect people, and when they do, what they'll cause. And then we saw that it gets about up to a third when those rodents get into the market. So they're concentrated, they're sharing more virus, and they're mixing with other animals that also have coronaviruses, with the possibility of making a new one. The really worrisome part for individual health and societal health and wellness is that once they get into the market setting where they're actually being sold into restaurants, more than half of those rodents that are being butchered and served in restaurants have coronaviruses. So again, this is in Vietnam. But I just want you to know that the risk of these spillovers is real and is going to keep happening if we don't start addressing what's happening in the environment, what's happening in the market, what's happening in the restaurant, and the consumer demand for that particular food that might be more risky than other foods. And we really want to motivate the world to look at this from all of those spots. One of the ways we're also working directly in communities that are at risk in their own homes because they have bats that are infected with things like a new Ebola that we discovered as part of this project. We wanted to give them the tools that they needed, so working with them to develop so that we understand their desires for how to work in their own communities and in and around their own homes, we could learn with the communities, learn from the communities, and come up with better solutions than if we sit in our ivory tower and sort of colonially say, you should do this, stop doing that. That has not worked over the decades, I would say centuries, and we need to think about a new, more holistic way. So again, using the wellness lens to say if you want to have a well family, a happy, healthy home, it's best for you to get the bats out of the home. And here are ways to do it. And when you find bats living in and around your homes, here are ways to live safely with them, to attract them away from your house, but keeping them also healthy and safe. Because when the bat populations are safe, guess what? They shed less virus. So we're really working in every aspect of this emerging health threats. Even now working with CEPI, which is a global nonprofit, to start to improve the supply chain and the pipeline for the development of vaccines, so that any new virus that spills over and starts to create a new disease, we can work with the international community to make sure that there is a vaccine within 100 days of that first sick person. That's our goal, together with CEPI and the international community. And we've developed actual tools, apps that you can play with. This one's called spillover.global, that you can play with to see what viruses are out there, how they rank, kind of like a credit score, if you will, and thinking about not just the virus itself, but thinking about the host, you, the wildlife host perhaps, where it evolved, and the environmental setting in how that virus might spill over. So these are just some examples of where we've been working in emerging health threats even before the pandemic, but how it's been accelerated and improved. I'm so proud of UC Davis because we absolutely did something very special with our Healthy Davis, which became Healthy YOLO Together, where we really looked at the wellness of our community and we put together an amazing testing platform across our Sacramento and our Davis campuses that protected people, allowed people to be tested in advance of any symptoms and know if they were positive and stay home so that kids could go to school. All the school children in Davis were tested as often as they like through our UC Davis system so that kids and teachers could feel comfortable getting back into the classroom. This is just a small sample of the amazing things that people pull together to do here through UC Davis and our amazing partner networks. So we really had some great success there. We also then were able to get some startup money to start an institute for pandemic intelligence so that we can use big data to start to pull in even more viruses into that spillover platform that I mentioned. We can start to look at how people really use social media and how that was impacting the decisions they make and how we can sort of get in front of that and help people with informed decisions in a way that they want to absorb that information in the future. And then we brought together a wide network of other universities around the country that did amazing things during the pandemic and said, what can we all learn from each other and how can we work together in advance of any new threat and then during new threats to really have a network across the country that will prepare us much, much better for health security for all across the world, but in our communities especially. So if I take you now to the next one, I don't want to just tell you we're jumping now to climate crisis. I want to explain even more how the climate crisis and emerging health threats, two of our grand challenges, are totally inextricably connected. So one thing we did on that PREDICT project I mentioned is we were able to identify where most of the yet to be discovered coronaviruses, now the next one might not be a coronavirus, but that's where we're working right now as we were already coronavirus researchers as well as other things, but we now know and you can see that the Amazon basin in South America is where the majority of the yet to be discovered coronaviruses live. And they live mostly in their evolutionary host wildlife animals. So if we think about that, what can we do about that? Now, guess what? If you look here, you can see this is the projected change in that same area in the Amazon basin where we're deforesting and causing our beautiful rainforests that are protecting our health and welfare globally by producing oxygen and helping us to keep climate change from going completely out of control. But what you see here is that is being vastly deforested and changing. So as you're pulling all those trees out, as you're starting to farm, what are you doing? You're bringing people to the area of the most undiscovered coronaviruses, and you're hurting the climate at the same time. Is there something we can do about that? We're exploring options, and some of them include actually not using people so much to look for those viruses, but starting to use, and we have amazing engineers here and around the world working with us to create, bots, robots, and drones that can identify the risky areas for us and send in different ones that can actually sample and find the viruses, inactivate them before they come out of the forest. What that also means is researchers working on climate aren't tromping through the forest. Researchers working separately on emerging health threats aren't tromping through the forest and destroying the forest. Instead, we're protecting ourselves and we're protecting the forest because we're working in a different way that's gentler on the planet, but also protective of our own wellness. And so you can see how we do that. Things like biomimicry, learning from the bats, and how they go and sample in the trees and maybe leave their coronaviruses behind. Learning from the insects, that upper right six-legged climbing robot, that robot can climb the trees and sample from the top of the canopy. So these are the kinds of innovations that I think are very exciting and where we're moving here to really think about, again, these problems holistically. Now, when we think about the planet and climate change, we can think about our own personal experience of how things are changing. We know how fast the planet is warming and the extreme weather events that we're all experiencing. But we also can look at what that's doing to the animals across the world and learn from them. And if you take this map of where animals are being threatened and can't adapt fast enough to climate change, if we overlay that with how vulnerable certain populations of people are, they overlap, not surprisingly, exactly. And so while we are protecting the planet for ourselves, we have an opportunity to really protect the biodiversity, for the whole planet from a climate perspective and just a sort of making good choices about what we destroy and what we protect. This is some of my own research, just so that you know that this is actually detailed work that is going on here. This is just showing actually viruses coming from the Atlantic for the first time into the Pacific, with animals migrating across the ice flows that used to be closed all year long. So you couldn't get past. So those animals in the Atlantic couldn't get into the Pacific. These are radio tag maps showing that they now can. And right when that ice shrunk enough for them to get through, we saw new viruses coming in to the Pacific. Again, it's not just humans flying around the world that's transmitting these viruses. It's our impacts on the world that are letting everything change. And this is a great deal due to climate. Thankfully, we have, again, amazing researchers. I put Isabel Montañez here. She's the head of our Institute of the Environment, and they are just doing amazing work on climate to both mitigate changes and slow what's happening to our planet. Hopefully, we can get to reversing what's happening, but at the same time, adapting to what might be our next new reality before we get after it fast enough. So we can't just say we're going to fix it. We have to be ready, just like with the emerging health threats, for what's coming while we're fixing it. And I'm so proud to be partnered with Isabel. We also have an amazing Institute for Transportation Studies that's working on electrifying all of our cars. We're electrifying the grids. We're working in agriculture to reduce the need for water and understand better how we can grow healthy crops with less of a climate impact. So I'm just so thrilled and excited about what's happening here at Davis. next I wanted to talk to you about how all of these things come together in our Reimagining the Land-Grant University Grand Challenge. Now, I'm not sure if you're aware, but a land-grant university is a public university that benefited from laws in the 1800s that actually took land and gave them to the universities, either to build their university or to sell and build an endowment to run their universities. Now, that was great. That meant land-grant universities were supposed to be working for the public good. So what the trade-off of taking that land and putting it into the universities was you will work on agriculture and other things of the time that we want for the global good. Now, the horrible side of that is that those and the University of California system is a land-grant university. The bad side of that is, where did they get the land? They took the land from indigenous peoples, from the tribes, most often illegally, if you will, breaking other agreements that were already in place, and making a physical plant or selling that land for the benefit of the universities to operate. Now, what that means is we have to reckon with that terrible history, but we still need to acknowledge the great work, for example, in agriculture that got done, and move forward. So we're using this Reimagining the Land-Grant University to really rethink how we do everything with a wellness lens. Societal wellness, thinking about diversity, equity, inclusion, justice, but also looking at the wellness of the people working here in our campus community. Are they treated equitably? Do they feel good about the work they're doing? Are they in a great well space? Are they working in healthy buildings and emotionally healthy atmospheres? So this is a big change from what's happened in the past in universities that really follow a model of thousands of years of European universities. So we have this land-grant university that's supposed to do the global good, but we forgot, or no one, the founders didn't realize that means you have to set up the systems to work for the global good. And so I'm, again, so thrilled that we have grassroots and our top leadership all invested in really thinking about our systems and how we make our community more healthy and well, emotionally and otherwise, so that we can really help contribute even more to the future of the world through this land-grant university structure. So right now, we're working with visioning sessions with our whole campus community. We're prioritizing relationships with the tribes and other indigenous groups to learn what they need to repair the relationships that are so old, but that have plagued us from the beginning, and also to really benefit from indigenous research and tribal knowledge that helped us do things like manage wildfires that we've just ignored in sort of the traditional academic environment. It's time to come together and say, you were doing so much right. Can you help us help the world to use that knowledge? And so, but to do that, we have to have trusting relationships. And of course, our troubling history has not lent itself to those things. So also, again, working on inefficiency, staff frustration, using that wellness lens to say, what do we need for people here to build something different and pull together to feel great about our work and do more for the world. And nothing is more important than the food we eat. So when we think about sustainable food systems, we have to think about who actually has access to healthy, delicious food. And how is that impacting like the nutritional growth of our children and their brain development? So this connects to emerging health threats, how that people make decisions, climate crisis, how people make decisions, and it connects to our ability to nurture and grow healthy humans so that they have the ability to focus on more than just getting food that day and making sure their kids are nutritionally well. So all of this is connected as well. To grow that food, we need to be thinking about the climate and how we're managing land. So every one of these grand challenges are very closely connected. And again, they are all linked to wellness, because if we are not thinking about the outcome as being our collective wellness, then we are not going to fix these world's wicked problems. So just an example, this is a study that came out during just at the beginning of the pandemic. And you can see that the lack of desirable, healthy food and access to that food, which is often an economic problem, we have gone from a prevalence of about 20% obesity in the United States across the country, this is divided up by state, to between 40 and 50 or even higher percent obesity on a statewide level across the entire country. So we have, again, an epidemic coming our way that connects to the emerging health threats and is driven by the climate crisis, but is really about food, how we produce it, grow it, produce it, get it into people's hands, and make it desirable so that it is better to eat healthy food than it is to quickly go to a drive-through, right? And get something that might contribute to this problem and obesity. And we think here at UC Davis, we have everything we need to do that. We estimate that about 1,000 of our researchers are working somewhere in the food system. So we absolutely have the best ag school in the country and often worldwide. We have the best vet school, same. We've been ranked the most sustainable university in the world, and we are also #1 for diversity, inclusiveness, and internationalization. So we know we can do it, but we have to pull together, and that's what the new Grand Challenges initiative is all about. So we're very excited that this really important issue is something that we're focusing on. And it also tells us here at home that we have a really important regional need to address. So even though we are here in this most fertile and productive ag area with what I think we're not just, we can't be humble enough not to recognize that we're ranked #1 in that area, yet we still have 40% higher food insecurity than the national average. And that is just unacceptable. So how do we get people the food they want at a price they can afford so that they can be healthy, their kids grow up healthy, and decisions and all the brain connections are made from childhood all the way up to protect us in the future? So we do have a little bit of a brain drain as we produce these great folks. They often go to the Bay Area, especially if they're interested in the entrepreneur and innovation ecosystem that exists there. And so we also need to keep them here working on entrepreneurship and innovation in this Grand Challenge and others for the greater good, but here at home so that we can really get going and connect all of the pieces from the basic research all the way to the product that the consumer wants that will help with their wellness. So we have Aggie Square, a new development. It's just emerging and on our Sacramento campus, really beautiful space that will connect the companies with the entrepreneurs, students, faculty, staff alike, in this new entrepreneurial ecosystem. And we really feel like if we can attract and keep people here in this region, that we have the opportunity to see a change in the food system. The food technology market is estimated to exceed $342 billion in the next 4 years. And nowhere in the country is there a significant national effort to meet this demand. And we have everything we need here. You've probably heard about the All of Us research program coming out of our Med Center. And it is just amazing work on precision health so that we can, collectively as a community, later you will be able to work with your healthcare and wellness providers to look at your family history, to look at your genetics and say, this is the best kind of diet for you to eat to be most well. We have the ability, taking it back to emerging health threats, to say this is the best kind of cleaning products for your household based on the risks that are happening in your household. And we have the potential to actually help the region and its economic development while addressing these grand challenges. And that's really what UC Davis is all about. So we can publish these amazing scientific advances. We can work on the farm and with producers and in the labs and in the companies to really change how food is produced and how people feel about it and how it's consumed to make a healthier planet. And that protects us from lots of other things like the emerging health threats where I started. So I've just been really fortunate to be able to talk to you today, and I hope that you notice maybe my over-enthusiasm for this, but it is just time for universities to be thinking about wellness differently and using it as the outcome and impact lens that we guide ourselves and measure ourselves by with everything that we do. So here at UC Davis, we're using that big picture and then the grassroots enthusiasm and the support from the top to really take on a different kind of approach to solving the world's problems. And I'm just so excited and thrilled to be working on it here and networking with other universities, NGOs, companies, and governments around the world to hopefully infect them with this same enthusiasm and the motivation to work together to solve the world's wicked problems. And with that, I also want to thank the staff, the team, Dr. Fishman at the Office of Wellness Education for partnering with us and making this big change at UC Davis, and looking forward to try and make changes here, as I mentioned, on our campus community, helping us all individually in our homes make good choices about wellness and have the opportunity to even understand and make those choices. So thank you for all of you attending that want to do that, because we need healthier society, and that will help the planet survive, and at least the human species on it survive and hopefully be well. Thank you.